Jen says they did it again. Another healthcare ad that's overrated. Tom says you're losing your touch. The press is underused and not outdated. Killer public relations, marketing, and social media in healthcare requires making the right moves at the right time. Welcome to the Overrated and Underused show. Here's your hosts, experienced marketers Jennings and Tom Testa, with special guest Adrian Stoner. Overrated and underused. The Overrated and Underused show.
Welcome back, everyone. It's that time again for the latest episode of Overrated and Underused. I'm Tom Testa, and joining me as she does every month, Jennifer Jennings. Hey, Jen.
Hey, Tom. Every single month I am here like clockwork. You can count on me.
That's it. Now, you know what? I'm going to say something because I saw an interesting post on LinkedIn from my fellow co-host that said that perhaps I might be the second best co-host in Overrated and Underused history. What's going on with that?
Well, there's only two of us, so not everybody can be first place.
You know what? If any of our great listeners want to chime in, please talk to us. The feud has started. You fired the first shot on who the favorite host or co-host of this show is. So we need to hear from people. All right, we got to get into the show. I think we've got a good show today. I think we both agree that 2020 in general, it was a year filled with crisis, right? So today's topic we're going to talk about is crisis communication planning. You know, I think we both agree, Jennifer, and no matter what the crisis is, it can be something small, it can be something like huge, like, a pandemic or a natural disaster or something that impacts your organization. We'll get into some of the specifics later. But how an organization handles a crisis can really be a defining moment for that organization and the people within. So major initiatives, when a crisis hits, major initiatives can be disrupted in the blink. You could be one moment getting ready to launch a product or a new initiative, and a crisis comes and that's it. That's on hold. It can impact partnerships. It can destroy reputation, and even careers can be derailed depending on how, crises are handled. Because again, like I said, I think it's such a defining moment.
You're exactly right in that 2020 really probably forever altered like how we look at crisis communications and responses. It was just kind of felt like you never knew what you could expect. So
right.
It was something different hitting every day, over a year of a global pandemic, racial justice protests, economic uncertainty. Just a lot going on at any moment. And that's just, huge, like global scales. I'm sure there was so many other smaller incidences for, specific companies and things like that. So I think across the board, people probably more so now, like moving into 2021, truly just have to expect the unexpected. Like you don't know what is going to hit, what's going to affect you, your company, your employees at any day. And whether you're a startup, you're a small company, a small business, a family-owned company, you're still not excluded from a crisis that could hit at any time.
Right.
Your CEO could be involved in a scandal, one of your employees could be involved in something. So you've got to kind of be prepared and have the plans in place. And for a type A person like me who loves to plan, this is my jam. Not everybody's built that way and wants to think of that or just thinks that that'll never happen to me. But those are the people that it probably will happen to.
But you're right. Saying that crisis can be predicted, it just can't. So I think the best approach and what I think we're going to talk about today is that's why it's still critical to have the structure in place, the planning in place, identify the people in place so that when a catastrophe, a crisis of any proportion, whether it's large or small, happens, I think that organizations, hospitals, healthcare systems, everyone in the healthcare industry who could be impacted by some form of crisis throughout their careers, the organization's existence, has a plan in place to be ready to activate and put into action when needed. So our show is we're overrated and underused, right? The thing here is we're not going to say a crisis communication plan, having one, is overrated. Of course not. But there may be some overrated aspects we'll talk about, and I think a lot of underused aspects of a crisis communication plan.
I think what I'm saying is that not having a crisis communication plan is overrated.
Overrated.
I think everybody, especially as we're going into 2021, Obviously, different types of organizations need more in-depth plans, but at least having the strategy and the plan in place to say like, hey, I know who is our spokesperson, who should be the one that's responding to this, what's our consistent messaging across, our website, our social media. And when the crisis happens, it's not the time to be asking around and saying, what's our Twitter password? Like, how am I, like, who's in charge of this? Like, you need to have all that in place and be ready to put out your response and your message immediately. So I think not having any form of plan is overrated. And I just think as we go further into 2021, more organizations should understand that their reputation is so closely tied to, these types of situations. Absolutely. So, you definitely want to protect yourself for the unexpected.
No, agreed. Let's get into it here. And in fact, I think we touched upon some of the factors that could generate a crisis, right? For many organizations, I think they fall into, two buckets in some way. And there's internal factors, right? So there's ones that could bubble up a crisis when it comes to things like controversy surrounding it, maybe an executive not doing something he or she should. And that can obviously turn into a big crisis for the organization. Even things like layoffs can be a crisis. I mean, because you always think, when it comes to news on the internal side, that if, anyone outside the organization caught wind of and they were to maybe share it on social or heck, write an article about it, you wouldn't want some of this stuff published without having some sort of strategy around it, to get your message out there, to get ahead of it. So there are a lot of internal factors, and also employees. You can't control everything your employees do. And they can also at times do things that would become a crisis for that organization. And I think we'll get into that later, especially when it comes to things like the use of social media. That's one where we've seen, employees, there sometimes isn't a hard policy or something involved, but an employee could share something, do something on social where, even though the organization would say they're not representing that organization, but still it's always tied into this is one of your employees doing X on social media. So that can become an issue as well. Then there's the external factors too. And those are things that you mentioned earlier, Jennifer. You talked about like natural disasters, the pandemic, when it comes to healthcare, cyber attack, right? Such a big crisis that's hitting a lot of healthcare organizations. So those are some of the external factors that can impact an organization.
It's obviously I said it 5 times in this episode already, but I think organizations really just need to kind of expect the unexpected and just know that when a situation happens, and it could be something that truly did happen, and the company needs to put out a response or, share the information publicly, or at least put their messaging in their side on, how they're responding to this. Or it could be something that got skewed. It could be a misinformation where somebody took something and put it in a different light. So I think, in some cases, a lot of companies and even just people, like, I think their natural reaction when there's a crisis is to just want to hide, want to protect yourself, not say anything, and just kind of hope and pray that it'll go away or that people will, move on. Like, yes, we have a fast news cycle, but I think when there is a scenario that happens, or when something happens, something goes wrong in your business, your customers, your employees, your stakeholders, they want to hear more from you, not less. Like, they want to hear your side, or at least a response in how it's being handled. It's probably never the crisis that destroys a company. And I don't know, maybe Tom could debate this, but it's more the response to the crisis from the company and how it was handled, because things happen. Obviously, like, there could be a scandalous CEO and some things are out of a company's control. But I think it's taking that, learning from that, responding appropriately, being very transparent in your message. It's kind of when it feels like a cover up, when it feels like there was, more scandal involved, is when it's really damaging to the organizations.
Yep. You said it right. It was all about getting ahead of things and making sure there's no misinformation out there. And that is, in my experience, one of the biggest things that really can make a crisis worse, right? So, you talked about the 24-hour news cycle and getting news everywhere. And that was the biggest thing in my past experience, is when a major crisis hit, right? You've got your own employees, in the case of healthcare, you've got, potentially patients, you've got partners, vendors, everyone, even if you're a hospital in a major metropolitan area, you've got your constituencies within the city, you've got city officials, things like that. So you've got a lot of people trying to hear and get updates on what this crisis is and what the latest is. And having misinformation out there can be really detrimental, because you've got things like Twitter, especially Twitter, where people are just tweeting things. Are they accurate? Are they not? You've got news reporters who are kind of under the gun. They've got to get it right, trust me. But they're also out there to publish something quickly, trying to beat the person who's at the other publication, the other daily or whatever, or the other radio station, to try and get that news out there. And sometimes things aren't accurate. Now, they're not intentionally trying to misrepresent the facts of the crisis, but sometimes it's not as accurate. And one little slice of detail that's either not right, or whether it's the timing of something or an affiliation with something or a timeline of something, can really make a crisis even worse. It can really add some gasoline. So, and I'll say this too, that, that's why, when we talked about a spokesperson or having, designating someone, a liaison, a spokesperson, usually your head of media relations or your head of public relations, someone who ideally already has relationships with the media, having them designated as the spokesperson. So they're the ones that the media are going to get the accurate information, and vice versa. When there is an update, that spokesperson can go to the press and say, okay, here it is. My last update was at 12 noon. Here it is, 3 p.m. Here's the latest. And that's it. And, no more questions. And on the social side, of course, this is where a new marketing team having a really good either social media member or team monitoring social, so that you can respond and clarify inaccuracies as needed. There's a couple parts to it here, but getting ahead of it and making sure that you have your clear, consistent message out there, and that is the message. And it's only coming from this one spot, within your organization, whether it's you're posting to the website, and this is where you're going to stay tuned to this one area of your website for continuous updates on the latest information, which you can then share on social. And then, of course, your spokesperson bringing that out to the press. So.
Yeah, I think when something happens, when there's a story to be told, or that is out there in some capacity, the media, they're going to tell it, whether they're getting the information from you or from so-and-so that knows this side of it. So as a company, if something is directly related to your organization, any of your employees, it is much better to quickly put a response together, a consistent response, and having one spokesperson so that you don't have multiple people talking to different sources and saying things in different ways. Like you want a consistent, accurate, factual, response with as much information as you have on the situation up until that point, that, is put out across all platforms and in all the scenarios. So that consistent messaging, having a response, not just saying, well, let's just ignore it and hope it goes away.
Right.
Especially even if it's something that's so left field, it's like, no, that's completely wrong. The easiest thing is to address it and move on. And because, a lot of times these can just fuel into these larger fires than, and it's harder to step back from that and kind of put out those flames versus had we addressed this in the beginning, it would have been a non-issue.
Yep. Getting ahead of the crisis when appropriate. It prevents you from looking disingenuous about things, or like you said, hiding things. But again, when it comes to the press, especially, they know sometimes things need to develop. So they know that you will not have all the answers right away. And that's okay to say. I know we've all seen that as well as a spokesperson. And same thing if you're putting a message on your main social media channel. It's to say, okay, we are still, this is still developing and we're still looking into things. One aspect that could be a bit overrated, I think it's the channels that we use in a crisis.
Overrated.
What are your thoughts on the channels used in a crisis, to be the vehicles for that consistent message?
I think it depends on the situation, but like if it was something that originated on social media where so-and-so's making a claim, or then maybe an appropriate response would be responding directly to that person. In most cases, probably having some type of official statement that gets sent out to customers or posted on the website. I think having one official statement with the full text of what the company wants to say. And then you can kind of refer to that, like link to that in social or email or however it is needed. Or if it gets brought up by, employees, like they have this resource, because that's the other biggest thing is, your C-level may be crafting this perfect message and knows what the appropriate response is, but making sure all of your employees from top to bottom know that message too, or know where it's located, or a plan for how to refer anybody that asks about the situation, like how that response should take place. And I think that's an important part of crisis communications plans that sometimes gets, overlooked.
Yep. Yeah, no, you're right. And let's just take the example of, again, unfortunately, it's very familiar to healthcare professionals, but a cyber attack, right? I think that's something where two very main channels could be, the website, your homepage, or a place that's very obvious on your website where you can have a message about the crisis where every constituent is continuously being updated and they can go to, you can drive folks there. And that includes the media. So it could be your homepage and then also something that you can share on social. I think those are two of the very main channels here to getting that consistent message out. And in most cases, you want that message to be there because it's going to really speak for itself too in a lot of places. So you want to direct media there, and this is it. This is our statement, and this is all we're saying at this time type thing. But what I would say about the email thing, because you mentioned about, emailing employees and stuff, and I think that is also, it's important, maybe a letter from the CEO. But I would just say this, no matter what you send to your employees or customers, it should be something that's consistent with the main message that's maybe on your homepage or whatnot.
If you are just tuning in, you're listening to Overrated and Underused on Healthcare Now Radio. Today's episode is Crisis Communication Planning. We've really talked about how important it is to have a crisis communication plan. And for the organizations that are listening and saying, okay, well, that sounds great. What do I do? How do I set that up? Where do I get started thinking about crisis communication? What kind of advice do you think you would give them?
In my opinion, crisis communication planning should be part of any organizational plan, as you have any other kind of critical organizational strategies and processes. A crisis communication plan should be part of that. Not to make it sound so basic, but identify that you have the vehicles in place to report this consistent message. So whether it's the website, social media channel, making sure you have the right people identified, the right IT people in place to help get the message where we need to, the right, marketing people or publicists. And so identify the right people, because this isn't just about the communications team when a crisis hits. It impacts various departments. And although you don't want 500 people involved in this plan, it's really identifying those key individuals in the departments that can practice discretion and can understand, that, when a crisis hits, they have to be at the ready. Because sometimes, too, a crisis can hit at 10 p.m. on a Saturday, so that you have people identified who are ready to jump into action. And that includes, emergency contact information for those people in your plan. So, okay, if it happens 10 o'clock on a Saturday, I can get Jennings and here's her cell phone. Like you said, too, last thing you want to do is be scrambling for a Twitter password at 10 o'clock on a Saturday night if a crisis hits. So making sure logins are there, so everything kind of in one neat document is a good start. But then you should also practice. It doesn't hurt to have even crisis planning in terms of a dry run or just practice the game plan just to make sure everyone's kind of sharp, and
yeah, I definitely think crisis training in itself is a good area, or even, for your spokesperson too, to make sure they're on the ready.
Right.
Perhaps it's a small organization and the most appropriate person, the head of the company or whoever should be that spokesperson, maybe they're not as comfortable in that role as they should be. So really making sure the person that is going to be, your spokesperson, feel comfortable in those roles. And if not, there's plenty of outside resources and training that can be done for that. No, I don't recommend, a small doc practice, probably bringing in a crisis communications team of professionals to prepare them. But, I think just even putting to paper, hey, here's our spokesperson. What would we say? Are there any, how transparent should we be? Are there any legal implications of anything that we should think about. Here's who accesses our website. Here's where we would place our messages. Here's our social media
Right.
Logins and everything. Like, you just don't want to be scrambling in those type of situations.
Clinicians Corner.
For clinicians, operating these smaller practices or medical groups, I think crisis communication planning should still be a part of their operational model, maybe just on a smaller scale.
Right.
And then, really kind of having, I think, even more important for those that may not work with the media a lot, maybe they don't have internal marketing or PR teams or, external agencies that they work with. So really making sure that, they're well-versed in, knowing what to say to the media and what not to say,
Right.
and making sure to kind of stick to your message and stick to not to, get nervous and ramble and, go off task without getting the message that you wanted to say across, much like I'm doing now.
No, but you're right though. It's true. Like even in a smaller practice, these clinicians who are maybe one doctor, two doctors deep, and then, a smaller staff, they too can be at the ready, because a crisis for someone in that position or a smaller practice could be something that different than what we may be thinking on a larger scale. So a crisis to them could be like a bad review from a patient on some of these review sites,
I mean, not even a review site. Maybe even it's just,
going to social.
Beth on Facebook that's, ranting about her dermatologist who botched something, or, like it's,
Beth.
It could be anything. Oh, Beth. And then people just get to sharing and.
But that's true. And that's where you have to get ahead of it, right? Because you see things, whether it's on, like you said, just a simple good old Beth taking a Facebook, or, Beth going to Health Grades or Rate MD. Most times people can take things with like, all right, let's really see if this is accurate or not. It could be one person's experience, but in a small practice, you still want to, you may think, well, what are prospective patients thinking if they see that, who are kind of looking at my practice and want to come, for procedure here, and they're seeing Beth saying her stuff on social media. How are my reviews rated? Okay, good. I've got, 30 that are great, and then there's one or two that are meh, So again, it's more knowing that that's out there. I think it's being like just aware, and then having a consistent response. If someone were to ask you, or someone were to call the front desk, who knows, or write on social media, yeah, I heard, Dr. Jennings, she really cut the wrong mole off that day and it hurt forever and I'm in pain, and it's like, okay, how are we going to respond to that? How are people maybe at the front desk or whatever, or who taking calls, going to respond to that? So not a major crisis, not a scandal, nothing that's, not a natural disaster or something like that, but still, again, a mini crisis that could impact the reputation of these practices.
No, I mean, I think definitely, on the smaller scale with practices and doctors, those reviews are important because, people are, they have their choices for, I mean, in a lot of cases, who they want to see. And a lot of it's based on reputation. It's based on what they've heard about the doctors. I know my daughter needs to, see an ophthalmologist for her eyes.
Mm-hmm.
I'm going to say, hey, who knows a good ophthalmologist in this area? Like, whether I'm asking friends or I'm asking, you're asking for, hey, I want to hear about a great person or a great experience.
Yep.
So, or, if I have nobody to ask, then obviously I would go to the Google and check out reviews or see, do
Right.
my research that way. So I think the reputation management side is very important for a practice. I think a lot more people write negative reviews than they do good reviews.
Yeah.
And I think a lot of people do know that. So especially like when I'm going to look for a hotel, I'm looking at reviews, and you've got to take some with a grain of salt and kind of understand that, like, not everybody's going to love every experience that they've had. And I think the same thing goes with, medical reviews.
Yeah, no, I think you're right. Seeing some of these reviews, you got to take them with a grain of salt. I think the hotel example is great. If it's you give a hotel 1 star because they ran out of Coca-Cola in the machine on your floor at 3 a.m., that's probably not That's not good enough to give them a bad review, right? So again, same thing. Sometimes a doctor may get a bad review because maybe they had a bad day and their bedside manner wasn't as great as it could have been. I mean, things like that. Also, too, we talked about this on the larger scale with big organizations in healthcare, but there's also employee stuff too, disgruntled employees that they may not have to be disgruntled. They could still do things that could kick off a crisis. Or, even, again, we talked about reviews, a Glassdoor review from maybe Beth's working, a former assistant working in the office, and she writes a Glassdoor review that isn't so flattering. So, I'm thinking, Jennifer, we talked a lot about these review sites. I mean, is this a future episode? I mean, I don't know. There's employee review sites. There's, patient review sites. Is this even? I wonder.
It's obviously something that all companies need to think about, but, there are more consumer reviews. I mean, obviously everybody wants raving reviews, and can you, give us a testimonial for, your great experience. But, when it comes to some of these, when you're talking about patients, and like I said, like more times than not, I'm personally, and I think, the majority of people don't think, oh, that was a great visit to the doctor. Like
right.
I'm going to go to their website and give them this awesome review, unless I'm prompted or asked, directly by them and kind of reminded and in that way, then maybe I will. But otherwise, if something bad happens, and I think this place is a horrible place for anybody else to go, or it was just the worst experience and they've completely ruined my life or my day, right, then probably, they may get a review from me on whichever site I could find at the time, or, maybe maybe all of them, I don't know, but not me, but Beth would do right. that. I wouldn't do that.
Well, that's what we're just trying to give people ideas and options and what to do to prepare for their Beth when their Beth enters their lives.
Knowing how to respond, or, whether not to respond to some of them. Because, in some scenarios, it's just a personal experience of a bad off day, blah, 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 blah. But if there are like malicious false claims in something like that, then that may be the scenario where you would want to craft a response, and whether it's a response directly to the review, or it's a message of, hey, you may have saw so and so's blast on I don't know, the public news, or I mean, it could be at that point, it could be anything. It could be something on the local news. So I'm done.
That's it. Great last word, Jennifer. And that's it for our show. Thanks to our listeners for joining us today. We are sponsored by Anderson Interactive and can be heard weekdays at 10 a.m., 6 p.m., 2 a.m. Eastern on Healthcare Now Radio. You can reach us with your questions at hello@andersoni, that's the letter I.com, or you can also tweet us at Jen_Jennings and Tom_Testa. And of course, don't forget to use the hashtag #OverUnderRadio.
Bye.
Thanks for listening to the Overrated and Underused show with your hosts, experienced marketers Jen Jennings and Tom Testa, and special guest Adrian Stoner. Overrated and underused.